Dr. Nirmala, Dr. Vaidehi, and all those participants in this session. Good morning, good afternoon, good evening. Welcome to the 1651st day of continuous uninterrupted Zoom set of IFPH. Let us start today's program with a silent prayer for 1 minute. Thank you and welcome back. Today we have with us Dr. SANDEEP SAIRAL, BHMS, Chief Consultant, Royal Dental and Homeopathy Clinic, New Delhi, practicing homeopathy since 2012. It's written 4 books, Homeopathic Arrows 1, 2, 3, and 4. The topic is research on vitiligo. So on behalf of IFPH and welcome to Sandeep, you can have the platform for the next 45 minutes. It's over to you. Please proceed.
Sir, am I audible?
Yes.
Okay, so let me share my slides first.
Yes, of course. The research on vitiligo, the first slide is on. Yes, please.
Okay, sir. Good evening to everyone present here. My today's topic is research on vitiligo. Straightforward, vitiligo means there's a white patch. Okay, vitiligo means white patch, and basic reason for the white patch is loss of melanin. And role of the melanin is to provide protection against the harmful radiations of sunlight, especially the UV rays. Now, if you see this world map, the most sunlight are on the equator side. So most sunlight is on the equator. So you require more protection on the equator side. Like you will have more melanin on the pupils living near the equator, like Africa, South America, or India. So you must have observed that the people living on the equators or around the equator having dusky complexion in comparison to the people living on the polar side. Now, correct pronunciation is vitiligo. The first description about the vitiligo is in Egypt and the Vedic text around about 3000 years ago. Vitiligo is inversely proportional to the distance from the equator. Means when you move away from the equator, the frequency of the cases of the vitiligo slightly decreases. Now, more cases you will be found around Africa and India, that's near equator. And in India, it will be more on the Gujarat and the Rajasthan. According to a theory, modern human originated in Africa and then they migrate towards the poles. So Africa on the equator side, so they will having more sunlight for provide protection. Melanin will be there more sunlight, more melanin, and the more dusky complexion will they have. Similar thing what I have told you earlier now. See, they are the cells we call melanocytes that form melanin. On the cell's surface, we have receptors. We call MC1R receptors, melanocortin 1R receptors. Okay. There's a hormone, melanocyte stimulating hormone. This hormone binds to these receptors and stimulates the melanocytes and produce melanin. This basic diagram you need to remember, like melanocyte stimulating hormone binds to these receptors, stimulates the melanocytes and produce melanin. The exact cause of vitiligo is unclear, but researches are going on to understand it more better. What I understood, I'm just sharing it with you. See, the apparent causes, I'm not saying they are the causes, they are the probable causes. The people feel so, the patient feels so. These are like vitiligo is linked with the stress. Vitiligo is linked with the genetic factor. Vitiligo is linked with the environmental factor. Sir, my slides are visible. Are they rotating or they are stuck?
Okay. Yes, no problem.
Okay. So vitiligo is linked with the stress. Vitiligo is linked with the genetic factor. Vitiligo is linked with the environmental factor, and vitiligo linked with this autoimmune disorder. We will take it one by one. See, first stress we will discuss. Stress is mainly regarding financial stress like job loss or family related like divorce sort of thing, or a trauma like a death of a loved ones, close ones, or any assault or accident, or the pressure at the school, work, home, or severe illnesses. Stress are also linked with the brain skin axis. Stress is linked with the cortisol. Stress is linked with the H2O, and stress is linked with the glucose. Now we will talk each part one by one, that too with the facts. First is stress linked with the brain skin axis. There's a Chinese medical university done some numerous researches on the brain skin axis. They found that the psychological stress can influence your skin immunity. What the other thing found that the psychological stress plays the crucial role in the pathogenesis of vitiligo. One more thing important, they found that psychological stress can induce the vitiligo and aggravate the vitiligo. Okay, this finding that it can initiate the vitiligo and aggravate the vitiligo, this finding can be used in the treatment also. How? Let us see this next slide. There's a King Khalid University in Saudi Arabia. A 41-year male patient came. He said he have a vitiligo patch on the right leg and the left nipple. On asking the history detail, he revealed that he was going through a family-related stress. Since 6 years, he was having stress. His treatment was started. He was giving vegetarian diet, alcohol-free diet, herbal drinks. And meanwhile, during the treatment, his stress also got reduced since 2 years. So we find in this particular, at least in this particular case, that when the stress is raised, you are having vitiligo or a fresh onset of vitiligo. When the stress is reduced, your vitiligo got reduced. So at least this was clear in this case. Next, there were 1,500 vitiligo patients. Study was conducted on 2015. Means questions were asked from there. A survey was done. Like what they revealed that around about 2 years before the onset of the vitiligo, they were suffering from some 1 or 2 major stressful events in their life before the onset of vitiligo. And one more thing was that if they have a multiple stress, they have a frequent vitiligo symptoms. Now, we have talked about vitiligo's link with the or stress link with the brain skin axis. Now we'll deal with stress link with the cortisol. During stress, cortisol increases and that decreases the A stage. I know everyone knows here, but I'm just revising it. Like there's a hypothalamus pituitary adrenal axis. Hypothalamus releases your cortisol releasing hormone. Pituitary releases your adrenocorticotropic hormone. Adrenal gland releases your cortisol. Let us understand this by a diagram for a better understanding. Hypothalamus releases the cortisol releasing hormone and that stimulates the pituitary gland, and pituitary gland releases the adrenocorticotropic hormone that stimulates the adrenal gland and finally releases the cortisol. When you have enough amount of cortisol, body sends a negative feedback mechanism towards the hypothalamus and pituitary so that we don't require cortisol if they have enough. Like what happened? When you have enough cortisol, body reduces the ACTH by negative feedback mechanism. Okay, let us understand this from medical terms also. See, there's an Addison disease. In short, if I have to say, Addison disease means just you have low cortisol. Cortisol is low in your body. What will happen if your cortisol is low? When cortisol is low, with the help of hypothalamus pituitary adrenal axis, it will increase the ACTH. See this diagram? If cortisol is low, ACTH will be more to stimulate the adrenal gland to produce more cortisol. See, cortisol is low, ACTH is higher. Now, when ACTH is high, it will increase the melanin and increase the pigmentation. Now, let us see a different condition just opposite to the Addison disease. We call Cushing disease. Cushing disease in brief, if I have to say, Cushing disease means you have high cortisol and high ACTH. There was a one case like study published by the medical journal Sweden. 62-year male patient having Cushing disease since a long time. He was given many medicines, but there was not good result as such or unsuccessful. Everything was finally his adrenal gland was removed or cut down. What result were remarkable, but one thing was that except that he developed a vitiligo. There was fresh development of vitiligo, fresh onset of vitiligo. It was found in many cases that there is a new onset or aggravation of already present autoimmune disorders during the remission phase of Cushing disease. Okay. What is the exact mechanism? We don't know yet, fully don't know, but whatever I have understood, I am sharing it with you. See, when you remove the adrenal gland, body no longer require to produce the ACTH to stimulate the cortisol. So the cortisol reduces. I am again saying this. See, during the remission phase of disease, during the remission phase of Cushing disease, you develop the vitiligo. Why? Because ACTH is low. See, you don't require the ACTH. Now, when ACTH decreases, melanin decrease, pigmentation decreases, it leads to vitiligo. So two conditions I have talked about. First is Addison disease that leads to increased ACTH, increased pigmentation. Second, during the remission phase of Cushing disease, there is decrease in ACTH that leads to decrease in pigmentation. So two opposite conditions we have talked about. Why ACTH is making the pigment? See, actually ACTH binds to the receptors that I have talked about earlier, MC1R receptors, and produce the melanin. Let us see this diagram. Earlier, I told you that melanocyte stimulating hormone binds to these receptors and stimulates the melanocytes and produce melanin. Now I'm saying ACTH can also.
Yes, doctor, please, you are muted. Please unmute, doctor. Dr. Sandeep, please unmute. Dr. Sandeep, please unmute. Am I audible? You are muted. Yes, yes.
Sir, now I'm audible?
Yes,
And
yes.
slides are moving. Okay, now. When the A stage is low, melanocyte receptors are not activated or less activated. That leads to low or less melanin, ultimately vitiligo. Now, see these both binding to the receptors. Both can bind, stimulate the melanocytes and produce the melanin. Now, I have one research. Let us talk about research study. For more facts. There's a research done in there's a research done in Egypt, 2017, in Al Azhar University. There were 100 participants. Out of 100, 60 were vitiligo patients and 40 were in the control group. And among the vitiligo patients, 30 were active vitiligo. Active vitiligo means the number of small patches were increasing, or number of small patches were grouping together and forming the bigger patch. And the 25 we have stable vitiligo. What we concluded from this, there were many parameters were considered. Right now, I'm focusing on ACTH. What I found in this, that in vitiligo, we have low ACTH. So I'm summarizing my report, that in Egypt report says that in vitiligo, you will have low ACTH in comparison to the control. So Egypt report says low ACTH will be there in the vitiligo patients. Another research was done in India, like ICMR, Indian Council of Medical Research. Sir, am I audible?
Yes, no problem.
Okay,
Please
okay. If there is anything, sir, please inform me.
Definitely.
So Safdarjung, ICMR, Indian Council of Medical Research, did one research in 1995 in Safdarjung Hospital. What they did, they took the sample of 108 patients, vitiligo patients, cultured their skin and added the ACTH. After adding ACTH, they found that 58 patients out of 108 patients showed pigmentations, means pigmentation increase. See, what two reports are saying. Egypt report says that in vitiligo, you will have low ACTH, and Safdarjung report says if you add ACTH, there will be pigmentation. So ACTH definitely have a role theoretically and practically, that we have confirmed. No. Korea also have to say something. Korea says that there is a depression center, Department of Psychiatry, Seoul, Republic of Korea. They says ACTH is linked with the depression. This is if high ACTH can predict the severity of depression. I know everyone have seen the cases of melasma. Okay, if we probe the cases, probe the patients who are having melasma, they will reveal that either they have depression or they had depression, present or the past. What depression have in depression have happened? You require cortisol. For that, you require ACTH. So in depression, you require a lot of cortisol. That require a lot of ACTH. So ACTH increases in depression. When ACTH increases, you now remember ACTH will stimulate the melanocytes and produce melanin. That's why you got cholesterol. ACTH, depression, ACTH, and melanin. Clear? Now, there is because of this axis, hypothalamus pituitary adrenal axis. You require cortisol. For cortisol, you have to be more ACTH. You require ACTH. Now, melasma. I've talked about stress linked with the brain skin axis, stress linked with the cortisol in detail. Now we'll talk about stress linked with the H2O2. Mental stress manifests at the cellular level in the form of oxidative stress and inflammatory reactions. Inflammatory reactions we can easily see, like if we have high ESR and C-reactive protein, we are focusing on oxidative stress. H2O2 is a key component in the oxidative stress. H2O2 is a culprit, you can say. H2O2 is a toxin that will cause damage later on. But we found that there's naturally a mechanism in the body, like there's a peroxisome enzyme that catalyze, that break down this H2O2 into water and oxygen. So, but next thing we found that in vitiligo patient, this enzyme's activity is low or a decrease. So when you have a low enzyme activity, what will happen? This H2O2 will accumulate, more H2O2 will be there, and more H2O2 will be there. It will affect your mitochondria, and mitochondria normally or usually supplies energies to the cells, is a powerhouse or having ATP, source of ATP. When mitochondria is disturbed, it will lead to finally cell death. In our case, especially, it will lead to melanocytes death. Genotoxic stress, about genotoxic stress, it means like your H2O2, especially your rhodopsin, not only will damage your melanocytes, it can damage or deplete your stem cells also. It means the source of melanocytes can also be depleted with this toxin. Let us summarize it for the better understanding. First one is mental stress manifests at the cell level in the form of oxidative stress. First. Second, when there will be excess H2O2 that can affect the mitochondria. Finally, there will be melanocytes death. We can understand this from a homeopathic point of view also. See, the first step is oxidative stress, inflammation. It's a psoric miasm. A second is H2O2 is excess. Excess means psychosis. And the final is melanocytes death. It's syphilitic. So according to me, all three miasms are involved: psora, psychosis, and syphilis. Now, we have talked about stress linked with the brain skin axis, stress linked with the cortisol, stress linked with the H2O2. Now we will discuss about stress linked with the glucose. This is a practical part. I think you will find it interesting. See what happened. During stress, glucose decreases, and when glucose decreases your melanin synthesis. See, glucose decreasing the melanin synthesis. And this logic or concept is used in the cosmetic industry. What they do, they just add slight glucose in your cosmetic products. What that do? That will decrease the melanin and you will look slightly fair. Understanding my point? Slight glucose making you slight fair. Suppose if you have an uncontrolled glucose in your body, okay, what will happen? You can become white, more white, like vitiligo condition can happen. See this. Let me give you the slide. See, glucose is used in the whitening and moisturizing of cosmetic cream, as I've already told you. Now, if you have an uncontrolled glucose like type 1 diabetes, so there will be higher risk of vitiligo. You're getting my point? Slight glucose making you fair. More glucose, excessive glucose, uncontrolled glucose can make you near to the vitiligo. Major risk factor. Now, glucose can inhibit the melanin synthesis, decreases the melanin synthesis. What normally in the modern science we do, modern science, like for the glucose, we use a high insulin or the metformin. It is found in the studies that metformin decreases the risk of vitiligo. Okay. See, glucose decreases the melanin synthesis and insulin will produce the opposite condition. It will hyperpigment. It will show the hyperpigmentation. Now, we have talked about vitiligo linked with the stress in detail. Now we'll talk about vitiligo linked with the genetic factor. If your parents, one or both parents having vitiligo, the chance of the baby getting the vitiligo is just 0.14% to maximum 20%. And monozygotic twins means like single zygote producing two babies and both babies getting vitiligo, it's just 3%. It means genetic factor is important. Yes, it is a factor, but it is not the only factor responsible for the vitiligo. Vitiligo is a multi-factor. Okay. Now, we have talked about vitiligo linked with the stress, genetic factor. Now we will talk about the environmental factor. See, the environmental factor is like there is a trauma. I have a case, just brief introduction. He was a mechanic. He says, as per the patient, according to the patient says he's just a mechanic. He says whenever he get a scratch, injury, or a trauma, he develop a new vitiligo. There will be a new onset of vitiligo. Any scratch, new vitiligo. There was a one teenage girl. He was having vitiligo on his legs. He says whenever he used to wear the jeans or remove the jeans pant rubbed his legs, and due to rubbing, his vitiligo patch increases. Okay. Next one is belt region. You will find more vitiligo cases on the petticoat region or the strap region or a bindi spot region. Chemical persons working in the chemical factory, bare hand, they can have the vitiligo. Sleeper, rubber sleepers. Some people say that they develop vitiligo and it look like just they are wearing the rubber sleeper. Okay, even if they are not wearing, it is due to that rubber reactions. Last case was LPG cylinder case. A patient was there. He says he used to supply LPG cylinder for the kitchen purposes. He confessed that he used to steal 2 kg per cylinder. What happened then? When he steals, the air or a gas hit his hands and fingers and he developed the vitiligo on his hands and fingers. I will talk about this LPG case cylinder later on. Okay. Till now, you can understand that chemical reacted and that's why the vitiligo happened. This is the environmental factor like trauma, pressure, chemicals, or gas, anything. Now, we have talked about vitiligo linked with the stress, vitiligo linked with the genetic factor, and vitiligo linked with the environmental factor. Now, we will talk about vitiligo linked with the autoimmune disease. Now, again, I'm studying this report, Al Azhar University, Egypt, 2017. 100 participants were there. Out of 100, 60 were vitiligo patients and 40 were in the control group. 35 were having active vitiligo, 25 stable vitiligo. Active vitiligo means number of small spots were increasing, or the number of small spots were grouping together and forming the bigger patch. So here again, the number of parameters were considered. Right now, we will focus on T3 and T4. We found from this Egypt study that in vitiligo patient, you will have low T3, T4 in comparison to the control group. Means thyroid hormones are low in vitiligo patients. When T3, T4 low, we call it hypothyroidism. The most common cause is Hashimoto disease. I have a conversation with many international patients. What they reveal that they having vitiligo, but their previous generation or parents have thyroid disorders, or their children are having thyroid disorders. Patients who are medically aware, they clearly use the word that their parents or just immediate previous generation having Hashimoto disease, or the children having Hashimoto disease. In fact, sometimes it is also, I have found that same person, the patient having vitiligo, also have Hashimoto disease also together. Both can exist. Other diseases are also there, like diabetes, especially the type 1 diabetes, anemia, other autoimmune disorders. But the most common I have found with the vitiligo is Hashimoto disease. And there's a theoretical doubt also that says that 34% patients who are having Hashimoto disease also have vitiligo, and the people who having vitiligo can have up to 2.5 times higher chances of getting autoimmune thyroid disorders. Okay. And it's bidirectional. Anything can happen first. Like if a person can have thyroid, then can have vitiligo. If a vitiligo, then can have thyroid. Anything can come first. And even in fact, both thyroid and vitiligo, both can have an onset on the same time. This I have found. Maybe the genes are common. That's why. There's another reason, explanation given, like actually T3, T4 stimulates the melanin, and T3, T4 you have melanin synthesis, and you have T3, T4 low in the vitiligo. That may develop the vitiligo. Okay, and that is the correlation. And the correlation is, see, we are considering it as an autoimmune disorder. Okay, when we are considering it as an autoimmune disorder, what happen in autoimmune disorder? Your immunity attack your own body cells, healthy cells. Especially in our case, it's attacking your melanocytes. And while doing so, they are attacking your, you have some thyroid specific antigens also in your skin, some different types of skins, like thyroid globulin, thyroid peroxidase. So somehow damage your thyroid globulin, thyroid peroxidase antigen also. What happened? There will be antibody developed against this thyroid peroxidase. Okay. Now, these in autoimmune disorder, what we have, there is everything is imbalanced. So when the antibodies are produced, they will be in excess. So these excess antibodies produced against the thyroid peroxidase or thyroid globulin, they will try to damage your thyroid gland. When the thyroid gland is damaged, now you will be secreting less thyroid hormone. That's the reason that leads to autoimmune thyroid disease after the vitiligo. That's one more explanation. Okay. So final conclusion I say that you have a autoimmune disorder can be there with the thyroid or with the vitiligo. Most common is autoimmune disorders is Hashimoto disease. See, I have discussed many. I have discussed here many like causes, probable causes, and mechanisms, pathogenesis, but they are subject to debate. Like you can agree or you can disagree with that, but there is a general agreement that vitiligo should be considered as an autoimmune disorder. Even scientists do agree with this point. Now, let's talk about treatment. Our next second half. Sir, am I audible? And screens are sliding?
No problem. Please
Okay,
continue. We'll inform you when the problem is there.
Okay, sir. Treatment part. So I'm considering that everyone here present like have deal with the cases of vitiligo and treated that too. If the medicines selected, it give results. Okay. Now, in vitiligo, I am again briefing. In vitiligo, you will be having white patch, and white patch is because you don't have melanin over there. But question arises when we treat the case or when the medicines is perfect, from where this melanin comes from in that patch. The question of this answer for this question is been given by Indian Journal of Dermatology. They says melanin actually regenerate or renew themselves from where? Suppose this is a vitiligo patch, they can regenerate it from the border, or if you have a single, even if a single spot is there of melanin, they can regenerate from there. And the last one is hair follicle. That's important. So, which cases are difficult to treat in the vitiligo? If your hair follicle is absent, or if you're having a white patch and in white patch, your hairs are also white. That's a difficult cases to treat because source of melanin is very less now. See, what we found that hair follicle contain inactive melanocytes that can be used to repigment the vitiligo. Okay, and if hair follicle are absent, just like the palmar region or soles or the mucosal regions, it will be difficult to treat. I have two cases of round about the mucosal region that I will share later on. Now, the melanocytes sources are melanocyte stem cells. Okay, melanocyte stem cells form the melanocytes. So, what are the sources or the option for melanocytes stem cells? Stem cells can be from epidermis, hair follicle that we recently discussed. Now we will discuss about the sweat gland. That is a practical part. I hope you will find it interesting again. See, the British Journal of Dermatology, 1997, a study was conducted on 39 participants. Out of 39, 17 were vitiligo patients and 22 were in the control group. In this study, we concluded that the vitiligo patient we have low sweating, means perspiration will be low. Okay, but what we normally see in a healthy persons that the anogenital regions, private parts, nipple, areolar regions, all are dusky or like dark or hyperpigmented in comparison to the rest of the body color. Why is it so? We found that two reasons are mostly prominently important in this, that the trapped sweat and the second one is hormones. So what I concluded, in vitiligo patient, you will have low sweat and when you increase the sweating, pigmentation increases, two concepts. So as we know, the sweating increases the hyperpigmentation. So I will advise like whatever medicines you are giving to your patients, you can give, but just advise them side by side. They should do sweat producing exercises and activities that will stimulate the melanocyte stem cells sources and help them in the to repigment their vitiligo patches. Just they need to do sweat producing exercises and activities on the regular basis to help themselves. See, sweat also releases the toxin. It's similarly like the way your stool and the urine releases your excretion waste. Similarly, toxin are also released from the sweat. And here in our case, it's H2O2. That is the main culprit that is destroying the melanocytes. So if you're doing regular basis sweat producing exercises and activities, that will help you in repigmentation. So we find three things. Like first thing, if you have diabetes, try to control that. Reason I have told you. If you have thyroid, try to control that. And third thing, do regularly sweat producing exercises and activities. Now, let us study this study again. British Journal of Dermatology, 1997, study conducted on 39 participants. There were 17 vitiligo patients and 22 in the control group. First thing we learned that in vitiligo, there will be low sweating. The second thing, this report says that the sweat also have low calcium. See, the vitiligo patient having low calcium, their sweat having low calcium, okay, have low calcium in the sweat. And calcium have some link with the vitamin D that we already know. So what happened? In 2013, Brazil have a study. What they did, they give vitamin D on the regular basis for the 6 months to 16 patients. Out of 16, 14 patients showed repigmentation up to 25 to 75%. And one more thing, like in our homeopathy books like organ and chronic diseases, it is clearly mentioned and many times mentioned that you should avoid external treatment, external applications. But what happened practically, that patient insists you sometimes, and if it is case of vitiligo and patient is insisting you, you can give them advice that they can apply vitamin D externally also if they want so, and that is safe to and help them effectively. So vitamin D, you can take the vitamin D, and vitamin D you can apply also. Now, so first thing is control the diabetes. Second, thyroid, control that thyroid disorders. And third one is take sweat producing exercise regular basis. Fourth one is take vitamin D as a treatment part or management, you can say. Now, black pepper. See the black pepper. A study was published in British Journal of Dermatology. This says that alkaloid of black pepper is papain, and they found that in skin cultures, cell cultures, this papain stimulates or proliferate the melanocytes, means they increases the melanocyte. That's what we require in the vitiligo. If something can increase the melanocytes. Okay, a study was conducted in King's College in London. They say that papain stimulates a uniform pigmentation. They provide a beautiful pigmentation. 3 cases were there, like 2 male patients, 151 age and 145 age, and there were 1 female, 37 age. All showed result, and their pigmentation started very quickly in 48 hours and 96 hours because of this pepperine or black pepper. I think everyone here present or who will be listening this later on must have seen that when we cut the apple and keep it for the some time, it color changes slightly brownish color. Why is it so? Why it happens? Reason is actually apple have some polyphenol. When we cut it, there is oxidation of polyphenol, and oxidation of polyphenol produce melanin. That's what we require in vitiligo. And this melanin is responsible for this brown coloration. Okay. So apple, after cutting, what happened? Polyphenol oxidation produce melanin. So we require melanin now. So now see, polyphenol help in vitiligo. Polyphenol produces the melanin, and polyphenol help to reduce the cells death, that is the melanocyte death, especially in our case, and neutralizes the reactive oxygen species, that is again H2O2, and regulate the immune response, means which is imbalance in autoimmune disorder. Your immune system is imbalanced, so polyphenol will help to balance it. Polyphenol have been studied as a potential alternative treatment strategies for the autoimmune disorder like vitiligo. What else apart from apple have polyphenol? See, black peppers, blueberries, black teas, dark chocolates, coffee, and then also broccoli, cabbage, onion, honey. If you remember, I have mentioned a case earlier about the King Khalid University, Saudi Arabia. There too, they used, see, honey. They used honey in this case, and that resulted them. Somehow, many factors helping you, some sort of a management. Okay. So, polyphenol helping you, the black pepper helping you, exercise helping you, if you're producing the sweat, vitamin D helping you, if you're controlling the diabetes, that helps you, and if you're controlling the thyroid, that will also help you. Now, see the types of vitiligo. We have a segmental vitiligo. Segmental means when you have vitiligo on unilateral side, single side, it was assumed earlier that the cause is external or maybe the external cause. And non-segmental means when you have vitiligo on bilateral, means both sides you're having vitiligo. Here the clear cut, the cause is central, internal cause is there, clear cut. When we have both, it is called mixed type. So this is the last study or research of today's webinar I'm sharing with you is Kawasaki University of Japan did a study from 1993 to 2011, and they studied on 30 patients. Just 27 out of 30 showed the follow-up. What they did? There was first we will talk about segmental vitiligo. They took the normal skin and grafted on the vitiligo patch and do some phototherapies, and after doing so, they found very good results of surgery in segmental vitiligo. Means surgery producing good results in the segmental vitiligo, but they started performing similar thing in the non-segmental vitiligo. Now they found that after doing even multiple surgeries in non-segmental vitiligo, there were no good outcome. Even in fact, they say that if you have an active vitiligo means your number of small patches are increasing or they are grouping together or forming a larger one. Then what happened? Their surgery is not recommended in the active vitiligo. Okay. In non-segmental vitiligo and in active vitiligo, you should not do the surgery. Differential diagnosis. Differential diagnosis is albinism. It means since birth you will having your hairs, eyes, and skin don't have melanin, clean clear cut. Nevus depigmentosus means since birth you're having just a single patch. Okay, circumscribed patch. Last one is pityriasis alba and tinea vasu. What happened actually? Parents comes with their children and they have a fear that they ask you as a physician, like they say that, doctor, is it this hyperpigmented patch, is it a vitiligo? And you know that most of the time on the cheeks, if the pigmentation is hyperpigmented, it's pityriasis alba, and pityriasis alba is one of like fungal infection and self-limiting. From 6 months to 2 years, it can go by its own even without medicine. Similarly, with the tinea vesicola and tinea vesicola, on the chest, on the back, you can have a hyperpigmented patches that too can also go by its own, like a more or less a fungal infection. Now, investigations are like first investigations like inspection. Just by seeing, you can detect it's a vitiligo. You need to see the mucosal region also. Sometimes you have vitiligo on the mucosal region. Ask the patient's medical history, like whether they are suffering from any other medical condition like diabetes, anemia, thyroid, especially the thyroid one that I have told you that thyroid is the most common one. Ask them. And if they have, just have a thyroid profile, T3, T4, TSH, and anti-TPO test, thyroid globulin, thyroid scan, CT scan, MRI. And for the diabetes, HbA1c, for anemia, CBC, folate level, B12. And inflammation, you can easily read like C-reactive protein and ESR will be elevated. Ask the family history also. If their family is also having vitiligo or any other autoimmune disorders, thyroid, diabetes, anemia, anything. Okay. The most common cytokines is interleukin 22 that is responsible in the vitiligo that you can also test. And parathyroid hormone. See, if you're having low calcium in your blood, the body usually extract it from the bones. For extracting it from the bones, they require parathyroid hormone. So in vitiligo, you will find that the parathyroid hormone is slightly elevated. When you treat the vitiligo patient and they are correcting, they are showing the good results, parathyroid hormone start to reduce, coming back to the normal. Another test is ANA test, anti-nuclear antibody test. Wood stem test is mostly performed by the dermatologist. And last one is the skin biopsy. I will say if you are, I would recommend that if you are going for the skin biopsy, especially for the diagnosis, please take advice of your nearby dermatologist, at least for the diagnosis. Okay. Now, see, whatever I have told you, whatever the mechanisms, whatever the causes I have told you, they are subject to debate, but vitiligo should be considered as it's a general agreement that it should be considered as an autoimmune disorder. Even scientists do agree this. See, what is autoimmune disorder? Autoimmune disorder means your body or your immune systems destroy yourself. Self-destruction is a syphilitic type, like your own immune system attacking your own healthy cells. Okay. What is psychological reason behind this is guilt. A person says he is responsible, he held himself responsible, reproaches himself, criticizes himself. Now, what is my hypothesis regarding this is that, especially for the autoimmune disorders, my hypothesis is like, if you on the regular basis criticize yourself, a self-criticism on the regular basis, if you do so, what happened after sometimes you start hating yourself, and what happened then your immune systems get direction to act against your own body. You are self-criticizing yourself, you're hating yourself, you consider yourself as an enemy. So now your immune system also considering you as an enemy. So immune system attacking your body, and it will expose whatever the loophole you have. If you have a diabetes predisposition, it can cause you diabetes. If you have a vitiligo predisposition, it can cause you vitiligo. If you have a psoriasis disposition, it can have you psoriasis. So if you remember, I have shared a case of LPG cylinder. Now I will talk about the rest of that detail of that case. Again, saying that LPG case cylinder was there. A patient says he used to supply the LPG cylinder for the kitchen purposes, and he confessed that he steals 2 kg per cylinder. And what else he says that he don't want to do this. He has a guilt, and he says he's doing so. He's compelled to do so by his fingers and the hands. So see, on the regular basis, he's criticizing. Maybe this is my hypothesis. On the regular basis, he's criticizing his hands and the fingers, blaming them, hating them, and after sometimes he considered them as an enemy. Okay, hands and fingers. What happened? Immune system directed towards the hands and destroyed the melanin over there. So he developed the vitiligo on his hands and the finger. 2 more cases I can share with you for the more better understanding. There was an international patient. She said that she has a vitiligo on his thigh, and on probing or on further detail, she told that that vitiligo on the thigh developed after she got raped. And see what happened. Now my hypothesis or the thesis can be like, she started hating his thighs region, the area of contact, that trauma. Okay, the sexual assault trauma. She started hating his thigh, criticizing himself, hating his thigh, considering that portion as an enemy that got contact portion. So what happened? After some times, immune systems also started attacking that, get directed and attacking that thighs area, the melanin area, because maybe she was having the predisposition for that, but the weaker immunity, like weaker barriers, her melanin got destroyed over there. Okay, I'm repeating it like his immune system attacked the skin over his thighs and made the vitiligo. There was another case. The patient was having a vitiligo on his penis or glans penis. On probing, it was a case like he was an immoral character. He was having multiple affairs, and he confessed that don't want to do so, but he is blaming his fairness. He says he was doing so, he is doing these stuffs only due to this. Regular basis, he is enjoying, but he is blaming this fairness and glassman. Okay, fine. Now, regular basis criticizing his fairness, consider at a certain point, he considered hatred, and then consider it as an enemy. Now, it's time for the immune system. Immune system, again, now consider that as an enemy and started attacking that fairness. And the first reaction was vitiligo. So these cases were like autoimmune disorder. This all three cases I have shared with you just to share my opinion or hypothesis that autoimmune disorder is quietly linked with the self-criticism or self-hatred. Self-hatred direct your immune system to attack your own cells. Now, that I have discussed you, melanocyte stem cells linked with the epidermis, hair follicle, and the sweat gland. Role of the melanocyte stimulating hormone is to bind these receptors and stimulate the melanocytes and produce melanin. When the melanin are formed, they are transferred to the keratinocytes also to protect the keratinocytes also. For that purpose, they require melanocytes, dendrites. The role of the melanocyte stimulating hormone is to protect your melanocyte dendrites also. Okay. Let's talk about the myosin. I have earlier also told you that vitiligo cover all three myosins, psora, psychosis, and syphilis. Now we will see which is predominating myosin. In vitiligo, what happened? You have loss of melanocytes. There will be loss of dendrites. And in mental sphere, we found most of the time there is a loss of loved ones or the physical abuses, like sort of thing. Okay. So it's a pseudosyphilitic. In this also, like if you see the skin, there's a loss of melanocytes. Okay, there's a loss of melanocyte, and in the mental plane, there's a loss of loved ones, separation. So it's a predominantly syphilitic myosin. See, whatever medicines you are giving, if it's working, it's fine. If you have got stuck in the vitiligo cases, try to select the medicine from the syphilitic group. That may help you, but that should also cover your mind aspect also. See, homeopathy is not based on the skin symptoms or the specific symptoms. You cannot give the medicine on that. You need to give the medicines on the basis of emotional state or the personality of the patient should also be considered. 213 aphorisms also support this point that they says that you won't be able to cure the case unless and until you are not covering the mind of the patient, and that should be matched with the medicine of the medicine mind also. Okay, so in this organ aphorisms, 213 aphorisms, Hahnemann also gave the examples also, like he said that if your patient is mild and you're giving Navsamika, it won't help you much. If your patient is obstinate or happy and you're giving Pulsatilla, it won't help you much. If your patient is not getting annoyed or not irritated easily and not get easily worried by the difficult situation and you're giving Ignitia, it won't help you. So you need to match the nature of the patient. And one more thing, there's a foreign author, Louise Hay, what she said about the vitiligo. She said that according to her research, she said that there is a cause of the vitiligo, according to her, psychological causes, that feeling completely outside of things, not belonging to, and not one of the group. Again, the further explanation is my hypothesis. I'm clearing it. See, person is not in a on the regular basis. He is not in the group, not included in a group. Suppose if he wants to be in a cricket team, if he wants to be in a friends group, he is regular basis excluded from that group. At certain point of time, he started criticizing himself that there is something fault in me, that I'm not included in that group or I'm not efficient at. On the regular basis, self-criticism, self-hatred, consider himself as his own enemy. Now, immune system damaging his cells, especially in our case, it's immune system will damage the melanocytes, leads to vitiligo. Okay, clear? Now, vitiligo impact is, sir, am I audible? Slides visible? Sliding?
Yes.
Okay. So, another thing we found that vitiligo impact is there is an embarrassment, clear cut embarrassment, like people are looking to them or they may feel. Or for that purpose, they don't go for the social gathering, they don't enjoy. So there is a depression, stress, loneliness more so. One more thing we found in the vitiligo cases from the studies is that in vitiligo patients have low melatonin. See, melatonin helps in the sleep. So this fact helps in the treatment part also up to some extent. Means if we are vitiligo patient, if you ask your vitiligo patients to take proper sleep and meditation, that will also help them in the vitiligo up to some extent. Now, there are some causes I have listed on the mental sphere that can be, or that could be the reason for the vitiligo is the embarrassment, ailment from the embarrassment, shame, insecurity, fear of being observed. Like person can feel, the patient can feel that everyone is looking at him. Say vitiligo pronunciation is vitiligo, eyes goes. The person feel that everyone eyes goes to him. मतलब सबकी आंखें उनकी तरफ जा रही है, देख रहा है नजर. Okay. Ailment from disappointment love. I will share one case from here. Like there was a boy in his early 20s. He says that he have a breakup with his girlfriend, and after that he developed the vitiligo on a lower abdomen. There can be cases like death of a child, death of the parents or the family. It's all like stressful factors, major stressful factors. Homeopathy, we can have few medicines like arsenic alum. We know there's a anxiety and restlessness. The theme of this medicine is there's an insecurity leading to the anxiety, especially regarding health and wealth. Lyco, what in medicine? There's a feeling of incapability and inability, incompetency, but he knows he is incapable or incapability, but he will pretend differently. There will be a boosting nature, sort of. Natramur, there is a reserved personality, introvert personality. There will be a history of grief and disappointment. Sepia, just an extension of Natramur. She will be like physically and mentally exhausted, and underlying hormone imbalance, and a flat chest we call. See, the hormone imbalance, I have told you, ACTH and CP mostly like we remember by the melasma. Okay, melasma, mostly happen during the menopause phase or after the childbirth, or maybe like hormone disbalance, hormone imbalance, CP. Okay. The fluoric acid and arsenic iodide is a purely suppletive medicine, help in the repigmentation. If you remember the case, I have told you like vitiligo on the panis or the glans panis that helped with the fluoric acid. Most of the time it is fluoric acid. If you have, that's my conclusion. My little experience is that most of the time, if you have a vitiligo on the glans panis, it's most of the time, if the mind symptoms matches, it's fluoric acid. Arsenic, iode having both like urs and iode symptoms like anxiety, restlessness, and weight loss is there. And the fluoric acid is like again, he will be very good with the strangers, and with the indifference will be there with the family members and the loved ones. No. If you are not able to find the mind symptoms, they have listed some symptoms according to the skin basis also, but this should not be every time considered, but just for a sake. Like skin discoloration, white spots, skin discoloration, white with a dark border, can ankles, if it's on the sole, if it's on the leg, thighs, face, and upper limbs, foot, fingers. Okay. So common medicines are listed are like this. The Silicia is a super medicine. I have found very good results. Ignitia also provided good results. Natramose, superb results. Auramed, Moxol, nitric acid, purely syphilitic medicines will help you. See, if a patient comes to you having 70 to 80% vitiligo, don't try to treat it. Just refer them to the nearby dermatologist. What the dermatology would do, whatever remaining part they have melanin, they will remove that. For that, they use MBEH, monobenzyl ether of hydroquinone, they use to depigment whatever the melanin left over. In homeopathy, we have a concept. If a substance can produce symptoms, that can treat that symptoms also if given in a potentized form. So there is a thought in my thought, like, can we potentize this MBEH? Because it depigment, it can cause depigment. Can we potentize this MBEH and have some trials in CCRH and government homeopathic hospitals and put the results or publish the results in the public platform? Okay. So most of the time people ask you what is the precaution or what should we avoid in vitiligo. I've just a single precaution or a single avoiding thing I will say, that too logical. That is, see, in vitiligo you will have white patch, and white patch because you don't have melanin, and melanin actually provide you protection against the UV rays or harmful sunlight. See, when you don't have protection or a shield, I will say just single protection or a single prevention is that just avoid excessive sun exposure because you don't have the protection. This is logical answer I can give you. I have some few cases I can just give you.
Excuse me, doctor, only 5 to 6 minutes remaining.
Okay, I've just finished, sir. Just showing you a few cases. Like, see, there's a vitiligo on the eye patches, eyelid. It got better at the medicine. There was a vitiligo on the foot. The small spots get connected to the border. Vitiligo on the leg, the northwest region, I would say get better. And after that, in the third slide, you can see the very good result, good improvement. And the slide, one more spot initiated. And there is a on scalp vitiligo patch spots or pigmented black spots. And after the medicines, this small spots increasing, black spots increasing, pigmentation increases. This was one of the wonderful case I have done. The nape of the neck, this girl having vitiligo after the medicine. This was the result. I have given this girl patient Cilicia medicine. There was one more case having the vitiligo on the nape of the neck. That girl, teenage girl, I gave him her ignitia. So medicine is not specific. It is according to the nature of the patient, personality of the patient. See, on the mucosal region, see the lips having slightly better slight pigmentation was increased after the medicine, just slight. And this the glass managed case. So I have done it. And takeaway points for the today's webinar is, see, I have told maximum about stress. That stress is the major cause, a detailed discussion on the stress. But see, who in this planet don't have stress? Everyone is having stress. So everyone must have vitiligo. But it is not the case. See, stress is a factor, but it is just a probable factor, like an exciting factor. There is something preceding factor. There is something, a seed in already about the vitiligo. It can be a genetic factor or autoimmune disorder. But yes, stress plays a role. So in management, if you ask the patient to do meditation and sleep, that will definitely help them. Similarly, trauma. Patient says that he have a scratch or a tear or a injury or a trauma, he developed vitiligo. Every scratch, vitiligo. Every scratch, new onset of vitiligo. But everyone can have a scratch, everyone can have an injury, but everyone don't develop the vitiligo. That particular patient is developing vitiligo because he was having some predisposing factor already. Okay, it's a again now genetic factor and autoimmune disorders are already. And for the trauma, I will say just if you're having developing the tendency of developing vitiligo after the trauma, just try to avoid that injury or scratches or rubbing. Okay, sweating, about sweating I have already told you. About vitamin D, already told you. And you can diabetes, I have told you about to try to control that, given the conclusion of that. And you can control the thyroid also, that will also help you. So I think I have done with my today's webinar content, sir. Thank you. Dhanyavad. Shukriya. Sir, I have done with the content, sir.
Yes. Thank you, Dr. Sandeep. Nice presentation, and you have done a wonderful job because I have studied a lot and almost dozens of references are also done from various research journals. Time for discussion. Those who would like to participate, please raise your hand. Only 3 to 4 minutes remaining. Then the last you mentioned about this, the persons affected with this so-called like main exciting cause, but not the diseases produced. As mentioned by Dr. Samuel Henneman, it is because of the miasmatic background. The patient is affected with the psoriatic miasm. Definitely these emotional causes will produce diseases. Otherwise, they don't have. That's the reason, according to Dr. Henneman. Dr. Ram Parvesha, what is your opinion?
Thank you, Manoj ji, and congratulations, Dr. Sandeep Sairal sir.
Thank you, sir.
Very nice presentation, excellent session. But vitiligo is main cause, background of miasm and intestinal disease, past history, suffer patient intestinal diseases, according to including jaundice, dysentery, 50% cause of vitiligo, dysentery, and jaundice, and family vaccination, 25% cause of vitiligo, vaccination inclusion, and family history, background of family history, tuberculosis या डायथेसिस, लिकोडर्मा जो फैमिली में है उससे भी ट्यूबरकुलोसिस से 30% चांस विटिलिगो, एंड लिकोडर्मा से 29% चांस विटिलिगो. डायबिटीज, वन कॉज डायबिटीज, 15% विटिलिगो, एंड सप्रेस्ड स्किन डिजीज 15%. So main cause of dysentery, 50% cause of dysentery and background of miasmatic. Very, very thanks, Dr. Sandeep Sairal sir. Nice presentation.
Okay, thank you.
Okay, okay. Thank you, Ram Parvesh, one of the senior physician in this platform. Now it is Dr. Tanesh. You can make your comments as a lot of thanks, please, Dr. Tanesh.
Thank you, Dr. SANDEEP SAIRAL. It's really an excellent session. You really show the beauty of homeopathy, because homeopathy and homeopaths never treat the disease but the patient, but the disease in patient person. That is what we will have to look into. And that's why in all these cases, medicine were different, and the protocol of treatment was also different, because there is no specific protocol. As you just stick on to the constitutional, the mental attitude and the reason behind the illness. That means the totality of the case, and you are able to prescribe in that way, and that really won the case. So every homeopath need to follow this kind of methodology, as well as you can study medicines. There are, of course, some medicine which are working in a better way. So you will have to study the medicine in detail to make sure that what you prescribe to the patient is the similar thing that the patient required. That's what the final answer to your presentation. It's really a worthwhile session. Most of our people will be able to follow your presentation. Unfortunately, due to some technical reason, we will not be able to upload the video for some time due to a ban from YouTube due to specific some unwanted issues. Of course, we will be able to release this video later, and by the time people will be watching your presentation, yeah, and it will be shared by most of the homeopaths. Congratulations, as well as thank you for such a wonderful presentation.
Yes.
On behalf of International Forum for Promoting Homeopathy, as well as myself, I am thanking you once again.
1 minute, 1 minute.
Yes, yes, please.
Trichoderma and vitiligo, Thuja, Scipia, Natramur, and Sorelia core is the best medicine in the homeopathy.
Okay,
Thank
okay,
you,
thank
sir.
you. Yes, yes, thank you. Okay. That's all for today's English edition. Hope you will be back again tomorrow. Till then, goodbye. And our Dr. P. Shaila to continue the program Malayalam.